and welcome to another episode. Folks, did you know that 1 in every 33 babies is born with a birth defect? Unbelievable. Each year, nearly 150,000 babies are born in the United States with birth defects, many with conditions so rare that most parents and even some clinicians have never heard of them. So January is Birth Defects Awareness Month, and my very special guest is Dr. Scott Adzick, MD, and Surgeon-in-Chief at the Children's Hospital of Philadelphia. Welcome, Doctor.
Thank you. Nice being here with you, Mark.
Thank you. Well, apparently there are approximately 5,000 fetal surgeries done worldwide to treat these birth defects, and a quarter of them have been performed at the Children's Hospital of Philadelphia, CHOP, one of the top-ranked and largest children's hospitals in the U.S., Doctor. that's a lot, isn't it?
That is. Actually, the numbers need updating. We've done more than 2,500 fetal surgeries at our center.
Yeah, I mean, each week at CHOP, you've got highly sophisticated fetal surgery teams there. They repair birth defects in the womb and place fetal shunts to treat life-threatening congenital conditions or perform minimally invasive procedures in the mother's uterus. What's the biggest concern that you have regarding this?
Well, it depends on the condition. I'll give you two examples of the most common fetal birth defect conditions that we treat. One is spina bifida, and another is twin-twin transfusion syndrome. So spina bifida occurs when the tissues around the developing spinal cord and the fetus don't form properly, and they're exposed to the amniotic fluid environment in the uterus, which causes damage to the spinal cord and those nerves. And the more spinal cord that's exposed, the higher up it goes, the more nerves are affected. And these are children when they're born. It's unlikely that they're going to be able to walk. They may well be wheelchair bound, and they have hydrocephalus and may require a shunt tube to drain that from the brain to the abdomen. We can treat this before birth between 23 and 26 weeks gestation, where term is 40 weeks. We have the largest experience in the world with this, with over 500 of these operations performed. And we and others have shown that if you do the repair before birth, you can prevent or ameliorate many of those complications. Now, it's much more likely to be able to walk, much less likely to have hydrocephalus, much less likely to require a shunt tube.
Well, Doctor, let me ask you, what types of conditions then can be helped by operating while the baby is in the womb?
Well, that's one example, spina bifida, right, between 23 and 26 weeks gestation. Mm-hmm. Another example would be twin-twin transfusion syndrome. So the setup here is identical twins in the uterus, of course. Each have their own amniotic sac, as opposed to each having their own placenta, which is the disc-like hookup between the umbilical cord of the fetus and the mother circulation. They share a single placental disc. And there's an imbalance of circulation due to abnormal crossing blood vessels between the two sides of the placenta, such that one twin, identical twin, gets too much blood and goes into congestive heart failure. The other twin doesn't get enough blood and goes into kidney failure, and will go on to die unless we do fetoscopic laser therapy. So that involves mother sedated. We put a fetoscope through her abdominal wall, through the uterine wall, into the uterus, visualize the placenta, and then use a fetoscopic laser fiber photocoagulator to occlude the culprit crossing vessels from the two sides, usually with an outcome in which both twins are saved. Those are just two examples.
Well, you must be elated when things work out okay. This year marks the 30th anniversary actually of your fetal center at Children's Hospital of Philadelphia. How has you and your team's research and innovations shaped the field of fetal medicine, do you feel?
Well, so 30 years is a long time. I came here from San Francisco in 1995, so we'll celebrate our 30th anniversary in June. Since that time, we've had more than 33,000 referrals of pregnant mothers carrying babies with birth defects from all 50 states and from more than 70 countries outside the U.S., including Australia. Mm-hmm. And And so there have been many so-called fetal first breakthroughs for different conditions treated before birth or diagnosed before birth. You think about mothers who come here for evaluation, about 2,000 a year. Only really 10% of them are eligible for fetal surgery. Mm-hmm. In most cases, baby can be treated after birth. We have a nice setup here with the Garbos Family Special Delivery Unit. So here at CHOP, most mothers can deliver here, and that baby can have the advantage of all the expertise we have diagnostically and therapeutically, for example, to treat congenital heart disease. So that's a nice advance. We played a big role in developing of diagnostic imaging besides ultrasound, which includes fetal MRI. So we helped to develop that, which gives you an additional diagnostic modality to look for birth defects or various features that are important for prognosis or for treatment. Mm-hmm. And then going forward, a lot going on going forward. Two areas. One is Dr. Alan Flake, who's one of our pediatric surgical scientists, working on the artificial womb in fetal sheep. The concept there is that babies born at 23, 24, 25 weeks gestation, where term is 40 weeks, but have a very high mortality rate, and those that do survive have a very high complication rate. You could just give them 4, 5, 6 more weeks in the in utero environment outside the mother in the artificial womb. Mm-hmm. And the mortality statistics go way, way down, as do the complication statistics. That would be an amazing breakthrough. We're close to applying this clinically in the next year or two, I think.
Right.
Dr. Flake's trip.
Wow.
The other area is led by Dr. William Pronto, who's doing work on in utero gene editing. Treat single gene disorders, sickle cell anemia, cystic fibrosis are just two of many where there may be many advantages to use CRISPR technology to replace an abnormal gene, single gene, a normal gene. So that, applied clinically, could affect thousands and thousands of unborn patients.
Right. We're hearing a lot about CRISPR lately, but I thought it was still a few years away, really, before we could get solidity. Let me ask you this, Dr. Adzick. Why is experience than the obvious, but why is it so important, especially when it comes to fetal surgery and rare and complex conditions?
Well, what is rare elsewhere is common here because of our center and expertise and referrals. We built up a program with just layers and layers and layers of expertise from many different specialties that I believe work together seamlessly. And we, of course, track our outcomes, patients in real time, so we can have accurate counseling and also inform ourselves in what we can do better. So all those things are important. Plus, it's important that we played a role in educating physicians and nurses, et cetera, at other centers, not only in the U.S. and Canada, but in Central and South America, in Europe, Asia, New Zealand, Australia.
Do you, you're probably too busy anyway, but do you get invited to speak on this topic around the world?
Exactly, yeah.
Yeah, there's a lot to share. Well, amazing work you do, and thanks for what you do. I mean, the field of fetal diagnosis and treatment, it seems to be constantly evolving. You have shared about CRISPR. I mean, the future, in your mind, what do you see as the future of fetal medicine? What does it look like?
Well, first of all, we hope to improve access for patients. And second of all, we hope to follow the science for those two examples I gave, the artificial womb and utero gene editing, which I think, whereas if you do an operation, it's sort of like a serial thing, one after the next big effort. We'll do fetal surgery for spina bifida tomorrow. There'll be 20 people in the operating room, for example. Whereas if you have in utero gene editing, that requires a single injection, curative, in the umbilical vein to the fetus to cure. I mean, that would be amazing.
Yeah.
It would affect thousands of patients.
It's exciting, isn't it? The goodness.
I think so.
You know, yeah, Dr. Scott Adzick, MD, but Surgeon-in-Chief of the Children's Hospital of Philadelphia. Absolute marvelous job. And, of course, January is. And if you want to read more, he covered a lot of areas. Why don't you go online to fetal surgery, okay, one sentence, fetalsurgery.chop, CHOP.edu. and you can read to your heart's content over a cup of joe. It's fascinating stuff. Doctor, thanks again. We know you're very busy. Appreciate you taking time out.
Thank you, Mark.
Goodbye now.